Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, September 21, 2021, and boy, do we have a lot to talk about today. We had tweeted out earlier that Nick Prashand, our Director of Epidemiology at the Chicago Department of Public Health, was going to be here today. Some of you may have noticed in the mayor's budget address yesterday, she shared some of the indirect ways that COVID has impacted Chicago, and some of that was based on some really good surveying that CDPH has done. We also have been working to take some of what we've learned from from COVID data and really translate it into a lot of the other health data that we look at. So Nick will be coming back probably either next week or the week after to share that in some more detail. In the meantime, I would refer you, please take a look at chicagohealthatlas.org. That's chicagohealthatlas.org. It's our new site. It's still under construction. And for those of you who are interested in data, and I know there's a lot of you, I'd encourage you to take a look at it. And then when he is on, if you've got questions or feedback, it's some of our post-COVID improving our data approach. But the reason that we bumped him off is just that, boy, are we getting a lot of questions, and there's a lot happening related to boosters, related to children, related to numbers in schools, and so related to, again, some of the safety of vaccinating. And so I decided just to take the whole thing to be able to hit your questions and go over additional data. So as always, you can put your questions directly into the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter, and we'll be taking live questions. We'll start with a quick look at our dashboard, chi.gov/COVID-. And if we pull it up, you see the news continues to look good here. We're averaging 414 cases per day. That's down about 8% from a week ago. And Cook County has the lowest case rate of any of the 97 counties in Illinois right now, and actually the city of Chicago is even a little lower than suburban Cook. So very pleased with that case rate, particularly in the context, if you look at our testing has gone up a lot. We're doing almost 17,000 reported tests a day, which is getting close. The most we ever averaged was just under 20,000, 19,900 back in November with the last peak. But with more access to testing, with more people getting tested, especially as we're starting to see some vaccine or testing requirements come in. It's been great to see tests have gone up 30% in the last week. If everything were stable, you would actually expect cases to potentially then go up 30%. Instead, we're seeing them down 8%. So we know we really are looking like we're coming down the other side of this. Our positivity in the setting of a lot of testing then is at 3%, and that's great, down from 3.6 a week ago. So just a reminder to everybody, you've got to look at cases and test perform and positivity rate. They all link to each other when you're assessing where we are. But broadly, things are going quite well, honestly, in Chicago at this point. Our vaccination numbers have held over 4,000 a day, which I'm pleased about. We were down to more like 3,300 a day in July, and those have continued to look quite strong, and our deaths and hospitalization numbers, are stable. Those are lagging indicators, of course, but it looks good. So let us know if you have questions about that, but that is the high-level data. I also think right off the bat, if you don't mind, just because there are a lot of questions about some of the CPS data. As a reminder, Chicago Public Schools is just one of the school districts and systems that the Chicago Department of Public Health works with. And so in all cases, when any school system is sharing out their data, it is their data. But I thought it was important just to help put some of this in context, because I know a lot of you are writing in. So if you look up, if you go to the CPS page, you can literally just Google Chicago Public Schools in COVID data, you'll find it, but it's also directly off the page. And this is the most recent data that CPS is currently posting. So you see it's for school year 21-22. Over here on the left is where you can look at the school year data for the previous year if you want to compare. But I just very high level want to put some of this in context for you. So where we look down here, the first thing that they have are what they call actionable cases. And that means any positive tests that they are aware of, particularly if these students or staff, are in school. So these are the cases that the CPS team is working on. These are cases that CDPH works on exposures outside of school settings. And you can see from when school came in session, August 29th to September 20, they're reporting here a total of 156 adults and 350 students with a positive COVID test. Those are really low numbers. And I know it might not sound like low numbers because you're like, oh my goodness, this is more than 500 positive cases. I want to remind, everybody, especially parents who I know are concerned about this, that we're talking about an ecosystem here between students and staff that is somewhere in the 380,000 range. This is the size of a medium-sized city. And this is not the daily rate of cases. This is the total number of cases that have been diagnosed and reported to CPS to date. And so where you look at, for example, 350 students across the approximately, 340,000 students that they have, that's about a 1 in 1,000 rate of case diagnosis. That is certainly not unexpected. And in addition to just these cases, there's also the work to see, are we seeing actual transmission in school? And that's, the state decided to redefine sort of a cluster and outbreak, even if there are just 2 cases where we think there's a link. Then those are reported. And we work, Chicago Department of Public Health works with Chicago Public Schools. Wherever we are seeing any potential cluster or transmission within schools, that's been very rare. And in fact, I believe as of last week, there had been 2 settings that had been reported. And honestly, just like last year, just like in other settings, those tend to be not in classroom settings. They tend to be the after-school tournament of some kind, the sports team, some of these other gatherings. Again, settings where it may be less controlled, and we know those have been higher risk. So I just wanted to put this, and we can, if you've got more questions, we'll talk about it, but I wanted to help you understand that 1 in 1,000 is a positivity even over this whole time period of 0.1%, right? Like not even 1%, 0.1% approximately. And then the other numbers on here, and to put these in some and this shows you, for each day, how many across the entire school system are coming in. We do expect those numbers to go up as more testing is happening. And this is the bottom part here, this staff and student COVID screening testing data. I wanted to put this in some context as well. So those top numbers are any way that a test comes in, but it is generally, often it's going to be people who are symptomatic, right? These are people who are known to have an exposure or have symptoms, and they've sought out a COVID test. In contrast, screening testing data, or sometimes we call it surveillance testing data, is meant to be a look for cases that otherwise would not be detected. So these are not people who are symptomatic. These are not people going to the doctor. These are people that we are testing, and CPS is testing in the school setting to basically see, are we missing things? The goal is not to test every single person repeatedly, because surveillance testing is more about, are we seeing a pattern that is concerning? Are we seeing a school where we're unexpectedly seeing cases that otherwise we would not have picked up in other ways? Are we seeing higher rates than you would anticipate? And so here, right as school starts, you're not worried about transmission really in school. The very first day of school, any case that comes into school at that point, by definition, did not get it in the school setting, right? As school goes on, there is some more potential, certainly, for transmission. And I think what we're going to see as we move forward here, there's a lot of quarantining that is happening at this point, right? Because again, even 500 so staff and students, it's not a lot in the context of 300, 400,000 approximately, again, a small town, but still there are a lot of contacts that are being quarantined. As we get the data on those, I don't expect in the classroom setting because CPS is doing the most important things, they are requiring masking, they are requiring the vaccination for all of the adults, and they did all of that really critical work of the infrastructure. You know, millions, tens of millions of dollars of investments, brought in the industrial hygienists, looked at the airflow and upgraded where they needed to. You know, all that was done last year. With those three things in place, you know, we know from data around the country, around the world, that's key. So this surveillance testing, you can see, is ramping up a lot. Last week, they were up to about 2,971 tests. What it doesn't say here is that's not 2,971 tests in one school. That's over more than 100 schools, right? And what we want is to actually get to a pace, you know, CPS has said they expect by the end of the month, they'll actually have testing capacity and be doing some of this surveillance testing across all of the schools. But you can see that in the first week and the second week, you know, 127 tests, not a lot of tests. That wasn't even a full week, but in that first full week, 930. Again, that's not a lot of tests in the context of the small city, but it is across a lot of schools. And then now we've ramped up to the 3,000. I expect that's going to continue ramping up. And already that's quite a lot of testing compared to anything that was being done last year. And there should be more testing. And I know that they are ramping that up. But what you see is that, for example, the week between the 5th and the 11th, there were 0 positive tests out of 930. Again, that's 1 in 1,000, not even, right? Like 0 tests, but like you've tested about 1,000. You've not seen anything out of the ordinary. You know, that's less than a 0.1%. I mean, in effect, it's 0, but like in terms of numbers. And then this last week, you've done about 3,000 tests and you've had 4 positives. Again, what would that be? 1.3 or something out of 1,000? We're not even talking 1% positivity here. We're talking like a 0.1, a 0.2% positivity. Very reassuring. And I just, you know, I wanted you to know how, when we look at this data, we're thinking about risk. First, obviously, making sure that when cases are detected, that there is the appropriate communications. And I know CPS has really been working on that so that parents and staff and everybody, you know, has awareness that there's been a case, and making sure that, especially right now when we're in very conservative mode, that the appropriate quarantines are happening. But what we're seeing is that in some of the school systems around the country, including, you know, a lot of the South opens before we do, that they're not seeing, as expected, a lot of spread among children or adults who are quarantined. The highest risk are when we let our guard down, not so much the classroom settings. And so we're starting to see some more places do some of these test to stay approaches, for example. And if everybody has been masked and, you know, had at least that, you know, and distanced and kept it on, and, you know, I know they're thinking about some more spacing at lunch, et cetera, the risk is really quite low based on everything we know. And so we'll continue to be working with CPS and all of the stakeholders using this data to make sure that we are working hard to make sure that students can stay in school as long as school is safe from a COVID perspective. And to be very clear, nothing here makes me the least bit concerned that school is not safe from a COVID perspective. And I know there's been a lot of worry about it. And I know it's worrying, especially if people didn't have students in school last year and now they are. And, you know, maybe your child's had to quarantine. I know that's very disruptive. But I just want you to know, from my standpoint, there are a lot of operational things that CPS is clearly still working on, and we're working with them to try, again, just with the very large number of students and staff that are in place here, working on communication, working on you know, just a lot of the processes, trying to be efficient, but nothing that I have seen at this point makes me concerned that Chicago Public Schools, and actually this is true for all of the school systems that we're looking across, we're not seeing anything unexpected, and I remain very reassured by where this information is. As surveillance testing ramps up more, we'll have a better sense, I think, too, of what some of that is looking like across school systems. So there probably will be some more questions, but I wanted to hit that right off the bat. So let's turn back to the screen if we can, and I want to just show a few high-level slides. Just go into the slideshow mode. So first of all, where we put our daily data into our regular transmission and risk matrix graph, someone had asked a question, where can I find this data online? If you go to the data tab and pull down to reopening, every single day these are updated, the colors are in there, and so that's an easy way to link this. But you can see our case rate remains at high transmission risk, but it is getting close. We're moving down towards substantial transmission when we get under 400. Our positivity has remained in the lower transmission, and both our hospital non-ICU and ICU are in substantial transmission and risk levels, but at the low end there. And they're both decreasing right at the moment, so the news is good. In terms of the travel advisory, we have 2 states that will be coming off the travel advisory. That is California and Puerto Rico. So I guess Puerto Rico technically a territory, not a state, but California and Puerto Rico currently doing the best in the country as far as case rates, and they've had 2 weeks now consistently holding below that 15 case per day. But what I will say is that Connecticut and Washington, D.C. had been just below it. They've risen up again. The country as a whole still not doing very well from a COVID perspective as Delta's coming through. We're not feeling it very hard right here in Chicago. We're at 15 per 100,000 per day ourselves right now based on our case rate. But I think, California obviously is one of the settings that's had the most success with vaccination in the whole country. And just reminding folks that if you are unvaccinated, please delay non-essential travel at this point. The risk really is much higher outside of the Chicago area in most of the places where you're going to go. And then for folks who are vaccinated and you're traveling, just be monitoring your symptoms. And if you are unvaccinated and travel, the recommendation is to do that test before and after and to do the quarantine. This is just, we'll be posting this. Our COVID case rates continue to really separate. The biggest risk factor is being unvaccinated very clearly. But you can see as the cases are starting to trend down a little, we're seeing that trend both among the unvaccinated in red up top as well as the fully vaccinated. These would be the breakthrough cases. Hospitalization rates similarly split, death rates similarly split. We'll be posting that. Our ZIP 60624, 3rd week in a row. Austin, East Garfield Park, Humboldt Park, North Lawndale, and West Garfield Park. 3rd week in a row. It's had the biggest increase in first dose coverage for eligible Chicagoans, ages 12 plus. Really happy to see that it's one of the areas we are still really focused on. And shout out to 60624. I also want to congratulate all Chicago zip codes. Really exciting for having reached 50% of eligible Chicagoans in that zip code, age 12 years and up, with a first dose of COVID vaccine. 60633, which is the furthest southeast, it still appears a little bit lower, but it's a data artifact related to non-Chicago residents because that zip code is split between Chicago and Cook. It also has a little bit to do with people getting vaccinated in Indiana, but our epidemiologists assure me that in fact we do estimate that zip code has hit that benchmark. So really excited that the majority of eligible Chicagoans in every zip code now have started their vaccine series. 50% is not enough to protect us, at a herd immunity level, but it is a critical benchmark, and I care more about that, seeing the entire city hitting that, than I do kind of the average, although they're both important. We've also got 50 zip codes now that have reached that milestone where half ages 12 year and plus have completed their vaccine series. And you see the ones in white here are the ones that just over these last few weeks, hit that first dose mark, and we would expect them to move into this second dose mark and be fully vaccinated. Because the kids, just as a reminder, Pfizer is the only vaccine still that is authorized for children under the age of 18. And so they do need to get 2 doses. Also want to give congrats. We've got 38 zip codes that have hit the 70% mark of ages 12 years plus with a first dose of vaccine. And we had our first southwest side zip code hit that 80% mark. I love seeing 80% of eligible Chicagoans, everybody over 12 plus in those zip codes, get covered. And so we had 2 new zip codes, 60605, which is Loop near north and near south side, and then 60632, too. Archer Heights, Brighton Park, Gage Park, McKinley Park, etc. And just like we celebrated last week, that Northwest zip code that was the first to hit 80% plus, seeing this Southwest zip code hit it is critical, because both of those are zip codes that have been hit very hard by COVID all along. So cheers to them, and wanted to share that good news. Okay, so let's turn to your questions. All right. We've got a few, right off the bat, questions about boosters, as expected. Mary Rodriguez on Facebook. What's the timing of a booster shot for the healthcare workers or for the general public? And we'll take Tom also on Facebook. Says, Dr. Harwady, I received the Johnson & Johnson vaccine. Is there any update on boosters related to people who received J&J? So let's do a quick update on what's happening with boosters, because there's been a lot going on. And we'll get Mary and Tom's questions with that. So last Friday, the advisory committee to the FDA, it's a group of independent experts called VRBPAC, met and made the recommendation that a booster dose, a third dose for Pfizer specifically, that was the data that they had to look at, should be added to the emergency use authorization, specifically for people over the age of 65. They agreed to that, and then they left some space open for people who were younger than that. Broadly speaking, people with potentially severe underlying conditions, or people who are working in high-risk occupations like healthcare workers. Now, there's a couple more things that are happening this week right now. So that recommendation on Friday went to the FDA. They're basically the advisory group to the FDA. The FDA will formally accept or alter that recommendation. I expect they will accept it, but that will be happening in these next few days. But then more importantly, the way this works is that the FDA is looking at the safety and the production, and gives the sort of green light in terms of, yes, a vaccine or a medication is authorized to be used. But the CDC are the ones who actually give the specific recommendations of who and how. And so on Wednesday and Thursday, tomorrow and Thursday of this week, the ACIP, the Advisory Committee on Immunization Practices, that again is the independent experts who advise the CDC, they are meeting and will be fine-tuning, most likely, the high-level authorization that the FDA advisory group has recommended. So they're having an internal meeting Wednesday. There will be a public meeting that anybody's very welcome to watch online. My team certainly will be on Thursday. But we've been in touch with folks on this committee. Obviously, this has been a big conversation. And so I would expect by the end of this week, after that formal, the ACIP will make the recommendation to CDC, and the CDC will give its formal and final recommendation. This is the same practice, to be clear, we always use for any new vaccine, for example. Doesn't matter, pre-COVID, advisory group, FDA, advisory group, CDC, and the specifics when doctors actually start having the details and can answer more of your questions comes after both of those. So I was very pleased to see where the advisory group to the FDA landed. When I look at this data, last Tuesday we had Dr. Ganai on, and he was showing a little bit of really the best data that's out there that shows that really all the vaccines continue to protect, especially against those severe outcomes, really, really, really well. And that is the most important thing. It's the main reason why we vaccinate. So I was pleased, and I think it's appropriate to be thinking about boosters for older people, especially people in nursing homes, et cetera. And it could be over time, as we have more data, there could be additional groups added to that, to the recommendation. But I think given the data that was here now, we certainly here in Chicago have seen more breakthroughs, especially breakthrough hospitalizations and deaths. They're rare, but where we've seen them, they tend to be in people over 65 or with these severe underlying conditions. So right now, everybody who is immunocompromised already has been approved to get a third dose of vaccine. And I know there are probably some people over 65 who are already starting, that's fine. But technically, the recommendation will be coming out more formally at the end of this week. There's no huge urgency on this, and I just wanted, to Tom's question about J&J, there was some news today that J&J put out saying, you know what, we've been doing our own booster studies, which I told you, everybody's doing their own booster studies. And their booster study showed that, yeah, getting a booster, a second dose in this case of J&J, suggested that it was even more protective. Not a surprise, but what it showed in their data was actually waiting a little longer, right? Waiting the 6 months actually had more immune protection than doing it right away, 2 months later, for example. These are the studies that are ongoing. They're ongoing for Pfizer, they're ongoing for Moderna, they're ongoing for J&J. And what I would advise to someone at an individual level, don't start trying to do mixing and matching yourself at this point, okay? If you got Moderna or J&J and you're like, ooh, I'm over 65, should I go get a dose of Pfizer right now? That is not something you should do sort of this week. This is the kind of thing, though, that the CDC will be giving some more formal advice, and its independent advisors. And frankly, if I had gotten the Moderna vaccine, I would not go and get a Pfizer booster right now. Our biggest priority is the people who are not even vaccinated at all, in terms of dropping the risk for everybody, even people who are vaccinated, continuing to keep the focus on people getting their first and second doses of vaccine is the most important thing. But my expectation is for people over 65, and you'll be able to get boosters through the pharmacies, through your doctor's office, through the clinics, our regular immunization clinics, all of the above. So expect a more formal update and recommendations probably at the very end of this week. And I hope that helps clarify. So Mary, on your question on healthcare workers, general public, more specifics kind of at the end of this week. I expect for healthcare workers, most likely, they will probably be included just because the risk is higher. But there will be some more formal guidelines around timing from CDC. Okay. So we got a lot of people asking, what's the status on kids under 17 getting vaccinated? And that was another piece of news. So in this case, again, Pfizer has been the furthest along here, and Pfizer said publicly, we've collected enough data now for children in the 5 to 11-year-old range, and they very high level put out that, first of all, it looks like the dose that they've landed on is about a third of the dose as it is for children over 12 and for adults. One of the main things, the questions here was, what dose do you need to give to make sure you're having the appropriate immune response, that you're not having unnecessary side effects, et cetera. So it looks like that dose is at about a third. This is one of the reasons why we've been encouraging younger, people to wait to do the, to wait for children to have the authorization. But that the vaccine was safe, it was effective, it did not give unexpected or higher, it did not give side effects. Their data looked good. They will be submitting this data formally to the FDA, they've said, by the end of the month. So really just over the next week or two, Pfizer has said they'll submit this data. And then we go through this process where the FDA, again, the advisory panel looks at it, the FDA looks at it, and then the ACIP, if they give the green light for emergency use authorization, then the ACIP CDC would again give the specifics about dosing and timing and how to fit it in with other things. I would guess at this point that we will have Pfizer vaccine available for 5 to 11-year-olds on that same time frame that we've been talking about, early November, possibly late October. The FDA has said publicly they are throwing a lot of extra resources at this, trying to move this just as quickly as they can. But let me be super clear. Everybody wants to see this data. The FDA, the CDC, us, the public, everybody wants to be really clear. I want to be able to tell you specifically in the trials what percentage of 5 to 11-year-olds, had which side effects, how did that different, what did the protective numbers look like? Because I want to make sure we all feel very, very confident about the safety and the efficacy of this vaccine. I feel confident about it, but again, show me the data, don't show me the press release. So over the next month, I expect this to be coming out, and my guess is we'll see that Pfizer vaccine on an EUA basis early November, possibly late October. All right, we've got a number of CPS questions, which is good. I like to hear those. So Alexandra on Twitter, can you talk about the number of cases we're seeing in CPS? That's what I addressed just now, started off with that. So again, important, I know some people have been trying to say, I want to compare this to the city rate. You got to remember, when we're talking about the city rate, like 15 cases per 100,000 per day is our city rate right now of COVID. And so if you're looking at the 500 or so, whatever it is, number of cases for CPS, that's over, I believe, 23 days in the population of CPS. So you need to make sure you're doing those comparisons. Activist Mama at C. Rissom on Twitter says, Dr. Arwady, do you stand by a previous statement you made saying that schools are not the source of spread? So broadly speaking, I absolutely stand by, and the way I said it and would say it is that in the great majority of cases, schools are not a significant source of spread. We will see some transmission in schools, for sure, because there are people gathering in schools. But in terms of schools being the major driver, the major source of transmission and outbreaks, I've seen nothing that makes me concerned in settings that are masking, that are requiring adults to be vaccinated, that have done the important work of thinking about ventilation and filtration, et cetera. I've not seen anything that makes me worried that schools are themselves causing major changes or driving community rates. Certainly not here in Chicago, but even around the country. All along, the biggest risk for and what tracks, and I've asked our epidemiologists actually to put together some more of this so I can show it to you visually. Generally, what we see tracking for cases in schools, the biggest risk factor is what's happening in community. And the biggest place where transmission happens, always, 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 do you know the answer? At home. Because that's the setting where people are not masked. They, of course, are in close contact. There's all kinds of risk factor. That is true everywhere, always, right? Think about our very first COVID case here in Chicago area, Illinois, a person transmitting to the spouse. Like that from the beginning and always is the highest risk factor. And basically, even where we see gatherings of students, remember we've had almost 2 years of experience with this, it's more often in the extracurricular type settings, whether that's musical settings, whether that's social settings, whether that's athletic settings, and that's why, for example, CPS has said, they're requiring some of that testing for students who are in those athletic settings, right? There is some different risk within there. So yeah, I've not seen anything, I'm never going to say that there's no possibility for spread in schools. We will see some small amount of spread in schools. We've seen just a very, like I said, a handful at this point, but nothing unexpected in what is the size of a small town. And I'm thrilled that kids are getting education, right? Not just the academic stuff, but a lot of that social and emotional needs. And I know folks are concerned about this, and I understand it, but I think things broadly are going well in terms of not seeing major sources of spread. I do expect cases to go up for sure, particularly as testing ramps up. But that's where we'll be separating between sort of the symptomatic diagnosed versus the ones we would not have noticed. And, we will update this and talk about this forever, as long as people have questions about this. Obviously, CPS is the one who can answer the specific questions about, if you've got a question about your school, you should be going to your school safety committee. If you've got larger questions, districts and schools make decisions about their policy. We're more in this advisory role, but we are advising, and we're advising CPS quite a bit right now, just in terms of ramping up, making sure that all these protocols are in place. But no, I feel confident about it. All right. Suzanne Bove from Facebook. What if you have a child that is turning 12 at the beginning of November? Which vaccine do you suggest? The lower dose or the normal dose? So that's a really interesting question. That's a great question. What I would recommend is that your child, when they get vaccinated, get the vaccine recommended for their age. So given that this is going to be sort of right on the timeline, I would probably do the higher dose when they turn 12. What you're not going to want to do, right, is this is just my personal recommendation, and this is the sort of thing that CDC will weigh in on, so I'll let you know if there's something more formal. But think about this. Say your child, I don't know when your birthday is. Let's say it's November 1st. Let's say that like November 1st becomes the day for vaccinating children, and your child on October 31st would get that lower dose and then would get the higher dose the next day. I would go for the higher dose personally, just because as they continue to age, then they're protected more like an adult. But it's not like, and just to this probably, I don't think this was your question, but for people who are wondering, it's not like CDC will weigh in on this, but I don't expect it'll be that my 11-year-old needed to get this series now and then needs to get a higher different series when they turn 12. Like, you'll be considered fully vaccinated as you age into that group. But I would probably, if it were my child, just on a personal level, I'd probably just give them the higher dose on their 12th birthday. But you should also talk to the pediatrician. And one of the reasons for the different dosing is that we may see more side effects, not dangerous side effects, but some of the fevers, the more sore arm, et cetera, we may see that at a higher dose. So I'll let you know if CDC weighs in some more. Personally, I would probably go for the higher dose for the 12-year-old, but talk to the pediatrician if you have questions. Alexandria Deanne from Facebook. Am I worried about fall, winter? Or she's saying to me, are you worried about fall, winter and the whole twindemic thing? Are we going to have to possibly change things like eating inside restaurants again heading into winter? So I think I would be foolish to not be at all worried about fall, winter. For those who don't know this twindemic line, it references the fact that every year we have a big rise with influenza. And the worry is that the sort of predictable rise that we see in the fall and the winter with influenza will certainly come along with at least some level of COVID on top of it. And if we see a pattern where the fall and winter becomes not just cold and flu season, but sort of cold, flu, and COVID season, it becomes more of a regular respiratory virus, then yeah, I am a little concerned. So what I can tell you is that, number one, we're definitely going to want people to get their flu shots, right? They're starting to be available now. Everybody over the age of 6 months, please, please, please get your flu shot. Obviously, get your COVID vaccine if and when you are eligible for the youngest kids. Those are the two most important things at the population level to help protect against that and to protect against hospitals. And around questions like eating inside restaurants, we are going to continue to follow our data. I hope you have seen all along that where we've made hard decisions, where we've said, sorry, we've got to require the masks again, where we've moved to have to put stricter things in place, they've been as we move into higher and very high and even beyond that rates of COVID and how it fits in. So our goal, you've heard me say this over and over again, is to stay open and to stay careful. If we have any signs that COVID or COVID and flu together is seriously threatening our healthcare system, or if we had a new variant came in where, for example, the virus, where the vaccine was no longer protective against the virus, or some other, I can't predict with a crystal ball, we could have significant trouble. I am hopeful and relatively confident in the way we've seen Alpha and then Delta kind of hit us here in Chicago. Nothing like what we saw previously, but we still have almost 800,000 people here who neither have had a COVID vaccine, nor we estimate have ever seen COVID, meaning they haven't had COVID and recovered. They don't have any natural antibodies. Given a choice, vaccine better than natural antibodies, but natural antibodies help, but there's still a whole lot of people. And so we have certainly the potential for trouble. So I'm hoping that we won't need to do more aggressive things, but we will if we start to threaten our healthcare system, or if this is changing to a point that we need to pull back on things. But having people get their flu shot and having people get their COVID shots is the most important thing. All right. we're just about actually at time. This went fast. Let me hit 2 more areas just really, really quickly. A couple of people are just writing in about ingredients of it. So Tracy Vidmar on Facebook says, why are they so eager to get Americans vaccinated, but Biden and others aren't? Why are we not being told the truth and ingredients of what is in the vaccine? And then we've got @Fluffy Klein on Twitter. Are you aware the vaccines are tainted with HIV, PPV, and mono? There's no data proving the vaccines have saved a single life. So I need to address both of these. First of all, President Biden is vaccinated against COVID. In fact, every living president is vaccinated against COVID. Also, every governor, Republican, Democrat, is vaccinated against COVID. Also, the huge majority of representatives at all levels, including in Congress, are vaccinated. And in terms of why are we not being the truth and ingredients of what's in the vaccine, we have some FAQs, we have some information about this, but let me just super quick, and to the fluffy kind, there is no HIV in this vaccine. PPV is it stands for purified protein derivative. It's the test we use to test for TB in people's tuberculosis in people's arms. There is no PPV in this vaccine. There is no mono. Mono is a virus in this vaccine. Here's what's in this vaccine. For the 2 mRNA vaccines, Pfizer and Moderna, there is one active ingredient. The active ingredient is the mRNA. Reminder, what is mRNA? M stands for messenger RNA. It is literally the instructions to teach your cell how to make the protein so your immune system knows how to fight off COVID. It does not integrate into your DNA. It never goes into the nucleus. In fact, it is dissolved within a matter of hours because one of the challenges here was about how to actually keep the vaccine stable. There is no killed coronavirus in this vaccine. There is no live coronavirus in this vaccine. There is no other virus. Obviously, HIV, none of these viruses are in this vaccine. The only other things in this vaccine are the things that are needed to stabilize the active ingredient. So the mRNA for Pfizer and Moderna, and then in the case of Johnson & Johnson, there's an inactivated, what's called an adenovirus that does not cause disease, does not cause harm, but both of these are teaching your cell how to fight off COVID without giving you COVID. The only other things in these vaccines, number 1, are fats. There's about 4 different fats. Those are just to help keep the mRNA, for example, which is very fragile, keep it like intact while it goes into your arm. Really common to have fats in anything that needs to be injected. This is a tiny amount. And when we say fats, it's things like, cholesterol that are in things that you're eating, like nothing crazy in here. Fats to help stabilize it. There are salts, which are to make sure anytime we inject anything, you want to make sure it's at the right sort of salt level for your blood and your body. And when we say salt, I'm talking about things like table salt, okay? Or potassium chloride. Nothing crazy, small amounts. And sugar, that's it. And sugar, I'm talking sucrose, like table sugar. Again, the sugar, the salt, the fat, the only things they are doing is stabilizing the one active ingredient, okay? In the Johnson & Johnson and in the Moderna, there is also a small amount of an acid, like citric acid. Again, not acid like it'll make you sick. It's something that, again, helps stabilize that. If you remember right at the beginning, there are a lot of things with needing to do extra cold storage, et cetera, around Pfizer. There's been some progress there, but no other active ingredients. And please, if you are reading things that, please send me something that you're reading that you think has any science behind it that suggests things like there's HIV or mono in the vaccine or something that you think has other ingredients. Because we've talked about this a lot on here, but it's been a little while, and I'd love to just help set the record straight. You can look on the actual, this is answered in a lot of places, and that is what is in the vaccines. So I hope that helps clarify that. And I've really liked it when a few, I know that there are people who watch this Facebook Live who are not vaccinated, and in some cases are really interested in sharing their beliefs about why they're not vaccinated. And I welcome that. I actually want people who are not yet vaccinated watching here. And I want to take your questions seriously. And I want to help you understand, why I sort of as a scientist and an epidemiologist look at all of this data. This comment about there is no data proving the vaccines have saved a single life. Literally, like these differences that I show every week between vaccinated and unvaccinated here in Chicago, especially where we take people kind of in that 50s and 60s, that late middle age group, people right here in Chicago, if they get COVID, Black and Latinx especially, they're like 50 times more likely to die if they're infected with COVID and they're unvaccinated versus fully vaccinated. I have nothing else to offer in modern medicine that protects against death at a level like that 50 times, except perhaps some other vaccines for other diseases. And so I have really liked it where people have sent in some studies, and I encourage you to do that. But please don't share information like that without it being based on something that you perceive to be fact. And if you have questions about the facts, send them, and we'll talk about it. There's nothing I like to do more, and I actually love having folks listening in and commenting who might not agree with me, because it helps me understand where people are coming from. I recognize everybody is trying to make what they believe to be the best decision for themselves, their family, their city. I have the benefit of a lot more training in immunology and epidemiology. I also care for patients directly. So I have seen plenty of patients, even in my own clinical practice, right, who have had COVID and long COVID. And I talk to folks all over the country who are taking care of patients who are hospitalized or have died from COVID. And it's just really clear that the vaccine is the #1 thing that helps save lives and helps keep people out of the hospital. My motivation around this is no more than to help save your life, to help keep you out of the hospital. And then in my job as the person who needs to make decisions at a public health level for the city of Chicago, I'm thrilled to see these continued improvements in vaccination at the city level, because that's how we get past COVID as a city. At this point, we're not going to eradicate COVID. COVID is going to be with us, and everybody in Chicago, at some point, most likely, your immune system is going to learn the lesson about COVID. You're going to do it the safer way by getting vaccinated, or you're going to take your chances with the disease. And I can't emphasize enough that taking your chances with the disease, especially if you're older, but even if you're not, we have young people get really sick sometimes. It's not predictable who they're going to be, especially if you've got an underlying condition, especially if you're in contact with anybody who's older or has underlying conditions. My team every day is talking to people who get COVID. Remember, we call every single case that gets reported to us to do case investigation and contact tracing. And what we're hearing over and over again is, I meant to get vaccinated. I'm not an anti-vaxxer. I was just waiting. I was unsure. Often paired with the, oh my goodness, now I'm so worried. Like, what if I've transmitted to my elderly mother? I was at a gathering. I've been trying to be careful. Like most people here in Chicago, they're careful. They care about their neighbors. They've been masking. They've been doing this. But, you take off your mask if you have dinner with somebody. You do this. And and then when we do see transmission and people getting sick and admitted to the hospital, where there are unvaccinated people in their family, often there's a lot of regret. I just don't want you to have that kind of psychological stress. It's stressful enough when we're seeing people get diagnosed with COVID and everything their families is going through, right? This has been just a really hard year for everybody. So sorry to kind of get on my soapbox there for a minute, but when I'm seeing people post these kinds of questions, please send me what you're reading and let's have a conversation about it. We may not fully agree on all of the details, but I want to set you straight on the science as much as I can and talk about how we understand how we analyze evidence, why I can feel confident in saying that this vaccine is safe and effective, just like schools, right? Why I can say, after looking at almost 2 years of COVID data in schools, different than what we might have expected, different than what we've seen for some other diseases, where schools take this seriously. They've not been the major drivers. They're a part of it, but they are not the major drivers, and that's based on data and a lot of years of me looking at this kind of work. So please send me your comments, but send them with links to data and studies and the things that you're reading, and we'll keep talking about them. Appreciate everybody for tuning in. We're not going to be on Thursday most likely, because I think we'll be doing more of actually a more formal kind of announcement and probably some more of a stand-up. But more to come there. If we don't do that, we will be back on Thursday. So you'll have some opportunity to hear more about what we're doing related to vaccination, testing. In the meantime, if you know somebody who's not yet vaccinated, have a conversation with them. We've got thousands of people every day here in Chicago getting that vaccine and doing the most important thing to protect themselves, their families, and Chicago. In the meantime, take care. Bye-bye.